शुरू हुई थी शुरू ही इसकी 2001
शुरू से यही हुई है एक में
मेरे को 2000 वो देना 6 देना वो वाला
और
ये देखो जस्ट बिगनिंग ये ना इसके ऊपर फोकस करना बिकॉज इट विल बी एन एजुकेटिव फॉर यू पीपल जस्ट गिव मी वन टू he is Mr. Hari Mohan Garg. He's 66-year-old. I've been knowing him for the last 2 decades. He presented this time with very severe breathlessness to the extent that it is unacceptable, and it happened very rapidly in last 2 weeks. And he said that he was doing moderate activities. He has an office in lower ground floor, and he stays in the probably ground and upper level, and he used to walk up. But normally, what used to bring, normal whatever the requirements of the house, and he used to carry things, he was okay. But suddenly he realized that he's breathless for the last 2 weeks, and it progressed to that extent. When he came to my office, he was hypoxic, his oxygenation was in 80s. And that's why he's in hospitalized, and definitely is better. But we have to understand why he's breathless, because he's a non-smoker. He's a non-smoker. He's a non-alcoholic. He never had any kind of and even he does not have any exposure to birds or occupation. What could be the reason? So we got a reason, because I still remember, I vividly remember, I used to treat him long back. So he was under a very great legendary man, late Professor Pandey. So he was a great pulmonologist. So I will just go chronologically what has happened. So we have collected all the cities. Now if you see the first city, this was in 2001. And if you see 2001, what I am trying to show, there are little small soft shadows, little hazing started in the lungs, and that is the time 2001. That means about 20 years back. Today is 2022. He's 66-year-old. So 20 years back, he must be 46 years old. So maybe everything start when he's very young. Probably he's in middle age, 40, 45. So he visited. They stay in South X. He visited Professor Pandey. A great J.N. Pandey. So he treated, he's a pulmonologist, and we could see an haziness, and he was evaluated on the lines of lung fibrotic changes, and they confirmed it to a sarcoid. Most likely his serum angiotensin converting enzyme and other factors will be normal. आपको बायोप्सी हुई थी लंग्स की उस समय?
नहीं एक बार उनकी बायोप्सी हुई थी कि पैरों में कुछ गांठें बनी
नहीं गांठें बनी थी. ल्यूपस पर्नियो is or sarcoid के साथ होता है. Skin manifestation of sarcoid. Sometimes you get erythema nodosum in sarcoids. पैरों में है कोई दाग आपका?
वो varicose veins भी है ना मेरे तो.
These are varicose veins. But normally sarcoid has got extra pulmonary manifestations. You can have erythema nodosum, lupus pernio, nasal lesions, whatever. You can have iridocyclitis. You can have uveitis and all.
Sir, he had uveitis.
You had आंखों में problem हुई थी आपको?
Yes, sir.
Yes, sir.
हाँ आई थी एक बार.
So that means he has an history of uveitis. He had an history of erythema nodosum, and also कभी आपको कोई टीका लगा के मांटू टेस्ट किया था किसी ने? वो एकदम नेगेटिव आया था, साफ आया था.
Negative, sir.
So that means negative मांटू टेस्ट, iridocyclitis, erythema nodosum, this disease. That means we can presume. We will check up his serum angiotensin converting enzyme. It's in sarcoidosis. Now if you see, very interesting happened. Then this is 2006. In 5 years it has progressed. It is becoming more nodular, from haze to micronodular shadows in the lungs. You could see. Now this is the time he was following up with Professor Pandey, and Dr. Prophetess Pandey initially gave him steroid because sarcoid, nothing much you can do other than inactive sarcoids. There are 3 categories of it. Stage 1 is self-limiting, stage 2 affects the lungs, stage 3 is progressive. Now he was okay. 2006 onwards he was fairly okay. Now this was 2011. You see here there are extensive changes, as if not only there are a lot of inflammatory changes, fibrotic changes, and probably some effusion is also coming. We don't know, maybe he has some secondary infection or not, but definitely that lesion gets more complicated. But you see there are patches, maybe he had some pneumonitis also there. We don't know, maybe he has secondary infections, but that has caused some ectatic changes. You have fibrotic changes and post-infective sequelae. You never know. Now he has come to me with 2 weeks of breathlessness so bad. He's so hypoxic, he's on non-invasive ventilation.
ऊपर
He's
रखा है,
respond-
ऊपर टेबल पे।
He's responding to steroids and all. But if you see the CT now, he's in National Art. You see the very interesting thing what we are finding here. You see the progressive emphysema. This is a pan-accident emphysema. So how can it happen this? So I'll give you an explanation, resident. This is a very interesting way, and this probably can help you to understand the chronicity of the disease. So I'll put it this way. He had a fibrotic changes in the lungs. Now, fibrosis means there is a volume loss in the lungs, and fibrosis makes your lungs very sticky because this usually happens extraalveolar, interstitial case. So he had fibrotic changes, maybe he had secondary infection. So some kind of bronchiectatic changes happened, like fibrotic changes was going on in his lungs. Maybe active, maybe non-active. Then what happened? The lung has a restrictive problem, but when you have some restriction in the lungs, there is also compensation happens because lung needs more space. So compensation changes started happening because this is called compensatory emphysema. Any fibrotic changes will have compensation, like you have seen post-tubercular bronchiectasis in other patients. Then this sudden probably happened and maybe he lifted some weight. Maybe his emphysema progressed.
सर मैं गोडाउन से भी वेट उठाया है अपना ना पेटी का।
There is a history of
गोडाउन से टेप का पेटी
tape ka peti because he's into they are into lights. They are very well known people. Philips lights. I know the whole family. तो कोई पेटी वेटी उठाया होगा, you know.
अभी उठाता तो काम मेरा इंडिविजुअल है ना।
Individual. Abhi now he's doing, but
सांस फूल जाता था मेरा उस टाइम में।
so what happened? He must have lifted something. You know, many of times in people who lift weight, they can rupture the lungs. It is something like a pneumo which you happened. So maybe those progressive emphysematous changes which was happening, that get converted into a bulla. You understand? And that's why he's so hypoxic. Now we have to treat them as post-fibrotic or post-sarcoid emphysematous changes in the lung. Now he's behaving like a COPD. So what we have to see is so let's evaluate two things. One thing for sure that he's hypoxic, he needs oxygenation, he needs COPD management, but at the same time we have to see, do we have got some activity of sarcoid coming back? So what all we can do? We can do a calcium, phosphorus, CRP, serum angiotensin converting enzyme, and also we can do a MANTU also. But let's see, we can defer it. But we will not do a bronchoscopy on this because it's a little risk. But we have to see overall in showing improvement. So we'll keep our fingers crossed, but definitely he should not be allowed to lift weights.
ठीक है।
ठीक है?